Most common knee sporting injuries that I see in my clinic are related to either the ligaments around the knee themselves, so that could involve your medial or lateral collateral ligament. It could also be related to your quadricep tendon, which attaches your quadricep muscle, which is a muscle in the thigh, to the top of your kneecap. And the other injury you can have is to your patella tendon, which attaches the lower part of your kneecap to your shin bone. Those would be the main structures outside the knee that can be damaged. The internal part of the knee is again very intricate, as you may imagine. And the main areas that I see damaged are the meniscus, which sits between your thigh bone, which is your femur bone, and your shin bone, which is called the tibia bone. And you have two parts to your knee. One is called the medial, the inside of your knee, and the lateral, which is the outside of your knee. And in the medial compartment and the lateral compartment, you have a meniscus. And this meniscus can get damaged from either trauma, injury, twisting injuries, or over time with degeneration. And this can give you certain symptoms, such as mechanical symptoms, which can cause locking, giving way, and you can find that there may be some clicking as well. These would be the main injuries that I see, but there's also, you can damage your cruciate ligament, which is called your anterior cruciate ligament, ACL. That is typical when you have non-contact injury, and it's a pivoting type injury that usually footballers suffer from. There can be a PCL injury, posterior cruciate ligament injury, or even a posterolateral corner injury, which is a bit rarer, but it is possible. So all of these things are seen in my clinic, and we are able to determine if this is the injury that you've sustained. We know by experience, a lot of our sportsmen are fairly demanding, and they want to be back and fighting fit as soon as possible, because any downtime from their playing or their game time does adversely affect them. So we completely appreciate that. But no, not all injuries require surgical intervention. Some can be treated by a watch and wait management strategy, but having the appropriate physiotherapy at the time. But also they may benefit from some injection therapies, which I carry out, such as platelet-rich plasma, osteolytic injections, which is viscosupplementation, or hyaluronic acid injections. And then as a last resort, we can then look at steroid injections. But I am always a little bit loath to go down that route for particularly sportsmen or sportswomen. I also find that there are certain injuries that do need to be managed surgically, and that again is determined after a detailed consultation, examination, and discussion with the patient. I believe for knee sports injuries, physiotherapy can be extremely effective. Even after surgery is done, physiotherapy is usually recommended, because physiotherapy addresses the muscles around the joint, and your knee joint is the largest joint in your body that relies on your muscles for stability and support. So the physiotherapist will work with you closely to rehabilitate your muscles. And if your muscles are of good tone and they are working well and functioning well, then they will have a very good overall outcome for your knee. And what I also recommend with physiotherapy is you can combine it with hydrotherapy, which is physiotherapy within the pool setting, and that can provide you with a general feeling of well-being, but also the water will give you buoyancy, allow your muscles to work solely on moving your joint rather than supporting your body, your skeleton, which is also designed to do. But when you get the buoyancy, the muscles don't need to work as hard, and they can rehabilitate much better. So certainly physiotherapy is usually recommended. The standard time for athletes can vary from person to person. it depends on what type of injury you sustained initially, what was the treatment and the management. Usually we find that if we treat some particular uh, clinical problems or injuries surgically, then patients are able to return to their level of activity sooner. But that's not the case for all injuries. And we do find that usually I give a ballpark figure of 6 weeks to recover from soft tissue injuries, but that usually is with a caveat that it could extend to 12 weeks as well, which is 3 months. 3 months is a very good time period to look at any type of injury that you may have sustained, giving yourself time to recover and rehabilitate. And once you've allowed your body to recover, because there's no way of us speeding up the way your body's recover at the moment, then you can really assess yourself again at 3 months' time and plan when you can return back to your sporting activity. I always recommend having a short return to your sporting activity. For example, if you play football and you're playing for a team and you've rehabilitated yourself and your knee feels just as strong as it did prior to the injury, I always say go on at the end of the fixture or the game, let's say, play the last 20 to 30 minutes, as you'll find that most of the other players will be tired by that time. They won't be as vigorous in their tackles. They hopefully won't be, testing you with your levels of stamina at that stage as well. And it just allows you an easier run to get back into your sporting activity and gradually build yourself up. Again, give your body time to recover, and you should recover and maintain that recovery going into the long term.